Hello, the topic of this video is sexual infections chlamydia. I'm Dr. Sylvia, the lead clinician at AskAwayHealth, the online medical advice platform. Sexual activity is meant to provide enjoyment and satisfaction. So how do we end up with sexually transmitted infections? It's because the process of sexual activity allows the transfer of germs from one individual who's carrying the infection to another person, the recipient. So whatever form of sexual activity you engage in, and by that I mean oral sex, vaginal or anal sex, etc., you could be at risk of contracting a sexual infection if your partner has the disease. Now, there's so many different germs that can cause sexual infections, but according to the WHO, the World Health Organization, the germs that are involved in the greatest transmission of sexual infections are 8 in number, and they've been classified in 2 different groups. The first group contained 4 infections that are curable and are chlamydia, syphilis, gonorrhea, and trichomoniasis. The second group is caused by viruses, and these are incurable. They include hepatitis B, herpes simplex virus, which causes herpes, the HIV, human immunodeficiency virus, and HPV, the human papilloma virus, that's associated with genital warts and cervical cancer. Today, let's talk about chlamydia. Chlamydia is an infection caused by a bacteria, a germ known as Chlamydia trachomatis, and studies indicate that it occurs, the sexual infection, occurs most frequently in young people aged between 15 and 25 or up to 30 years. The best thing about chlamydia, if you could find something good about it, is that it is curable. The worst thing is that unlike some other sexual infections, it may not show symptoms in somebody who has the infection. So if that individual has unprotected sexual intercourse with one person or many other people, they can easily pass chlamydia to all of those people. In the instance when you get symptoms from chlamydia, I'm going to list the types of symptoms that could present. So in women, they could have a vaginal discharge. They could have pain when passing urine or pain in the lower part of the tummy, which is called the pelvis, and that's right above your pubic area. Another symptom that could happen if you have a chlamydia infection as a woman is bleeding after sexual intercourse or in between your periods. And something else that people might experience is pain during intercourse. Now, for men, the more common symptoms that they have, if at all they show them, are discharge from the penis, the urethra, which is the tube within the penis where urine comes through. Men could also experience pain when passing urine. Now, I do need to say that in addition to the reproductive organs, chlamydia can also result in infection in the eyes, the throat, and the anus, or the back passage. So, if chlamydia doesn't really cause symptoms most of the time, why should we worry about it? And that's a good question. The simple reason is this. Although it might not make you distressed with pain like herpes infection or cause a really bad discharge like gonorrhea, it can quietly damage sexual organs, leading to complications in the future. One other condition that does this is high blood pressure that operates like this. We just published a video about this topic, so if you're interested in learning about hypertension, please check out that video. But the point is that some people may not realize that they have high blood pressure and they don't take any treatment. So as the high blood pressure continues untreated, it leads to damage of key organs, and nobody knows anything until it's quite advanced. So in women, chlamydia can lead to infections in the upper part of the reproductive tract, like the womb or the fallopian tubes. And this can lead in turn to serious infections like pelvic inflammatory disease, also known as PID. And the subsequent damage to these organs can cause an ectopic pregnancy or can result in infertility. Now, men can also be affected by chlamydia because it causes infections within the urethra, which is that tube through which urine comes in the penis. So that can get infected, but it could also get infection of the testes, and this can lead to complications like infertility as well. So this is why it's important that you know about the existence of chlamydia and the potential risk of catching this infection from sexual activity. The fact that people know more about it means that we can identify it quickly and treat it properly. Now, testing for chlamydia is quite simple. For men, we can either get an early morning urine sample, which is also known as a first catch urine, and test that for the chlamydia germ, or we can carry out a urethral swab. So that is getting a swab from the tip of the penis where the urethra, that tube, starts. The former is preferred by most people and it's quite sensitive to identify an infection. In women, we can use self-taken vulvovaginal swabs to identify the chlamydia infection. So in the past, we had used a speculum and you needed a doctor or nurse to examine and get swabs from right within the cervix to find out if the germ chlamydia was within the reproductive organs. But more commonly, that process has been replaced by using the self-collected vulvovaginal swab, and it's found that this is actually more effective and of course is preferred by most female patients as well. In any case, following any of these tests, if you're found to be positive, your doctor will issue you an appropriate course of antibiotics, and that depends on your medical background, what other medications you might be taking, as well as your allergy status. Right, so that tells us a little bit about chlamydia, but I thought it might be useful to go through some common questions that people ask when talking about sexual infections and chlamydia. The first one is, when can I have sex again? Now, we would usually advise you to complete your treatment with the antibiotics before you resume sexual activity. But if you find yourself in a circumstance where you are going to have sex, then use condoms while you're still having the treatment. Whatever the case, it's important to use condoms always when you have new partners or relatively new partners. The second common question that people ask who found out that they've got chlamydia, have got a sexual transmitted infection is, what about my partner or my ex-partner or my ex-ex-partner? And that's a really important consideration. It's embarrassing, it's upsetting to think, well, how did you get the infection? Who did you pick it up from? But getting past that is also the fact that whoever it was may also have an infection and is possibly transferring that infection to other people if they don't realize that they've got it. And don't forget, we've said that the most common symptom of chlamydia is no symptom. So it's transmitted from one person to another, and it's important to talk to them if you can, to direct them to get tested and treated. In some countries, the embarrassment is taken off you because there are discrete methods of partner notification, which can help in locating partners that you might not be in contact or you don't want to contact anymore, and keeping your identity confidential, but at least allowing them to get tested and get treatment. Another question that people ask often is, can I get it again? And the answer is absolutely yes. So once you're treated properly, you've completed your course of antibiotics and the symptoms have cleared, it's important to remember that if you expose yourself and do not practice safe sex, you could get the chlamydia infection again. And lastly, another question that somebody asks after a course of treatment with chlamydia is, should I be retested? Now, we don't usually recommend testing again after you've completed the course of antibiotics as recommended by your doctor, and you've made sure you've taken all the doses. Because sometimes if you go ahead and test as soon as you finish the treatment, you may still find traces of the germ within your system. That doesn't mean it's not been treated. It just means that there's some aspects of the germ that your body can still, that the test can still pick up. Now, so we don't do it commonly. But if we suspect that the person has not taken the medication properly, or they continue to have symptoms and we're not really sure what's going on, then yes, we will retest. And lastly, I can't overemphasize the importance of condoms in helping to prevent sexual infections. Available are male and female condoms. A lot of design work is going into male condoms in particular to make them more user-friendly, improve user experience, and encourage people to protect themselves more using these, because they're quite honestly the best barrier. Condoms are quite honestly the best barriers to sexual infections that we have in present day. So thank you for listening. If you have any questions on this topic or any other topic, please send me a private message on this channel, or you can contact us on info@askawayhealth.org, where I and my expert colleagues will be happy to answer and address your concerns. Please remember, subscribe to our channel if you found this video helpful, like it, and help us grow. And when you subscribe to our YouTube channel, don't forget to click on the notification bell so that every time we publish a new video, which is usually about once a week, you'll be the first to know about it. Now, if you can't wait for the next video and want to check out any more medical information like this, please visit our website on www.AskAwayHealth.org. All this information we'll put down in the link at the bottom of the video. Until next time, stay well.